Jennifer Forristal has earned an impressive 3 degrees from the University of Louisville. She received her Bachelor of Science in Chemistry, her Master of Public Health, and her Director of Philosophy in Public Health Sciences and Health Management and Policy. Since completing her education at U of L, she has served as Senior Vice President of Innovative Strategic Agreements at Optum, a leading information and technology-enabled health services business dedicated to help making the health system work better. In her spare time, she volunteers with Fed with Faith, a Louisville nonprofit dedicated to addressing homelessness. Introducing this year's School of Public Health and Information Sciences Fellow, Jennifer Forristal.
Well, it's so different from undergrad to graduate school, just your interactions with the teachers. Your classes are smaller, your teachers are more invested in you. You make personal connections with your professors, and there's, especially if you come into your master's already having some of your career behind you, so you have a perspective when you're learning things. So, when I was there, I already kind of knew the path I wanted to take in my career, and it really helped me focus my studies in a specific way. Yeah, I think that, everyone in the policy department, especially my advisor, Dr. Wayne Scott, on my dissertation, they were just very big proponents of you and being a success. They just really champion you and they want to see you succeed. So they're going to help you in any way that they can. And I just really appreciated that. Sure. So I leveraged my chemistry degree from U of L to work in a lab. And that's where I kind of started out, was testing raw materials. And then I moved into the pharmacy world, working for Kindred Pharmacy Services, which is downtown before they got bought. And I worked there for a while. And then I moved over to Humana. And I was there for almost 10 years. And when I was there, like I mentioned, I did my master's and my PhD. I was able to use Humana data for my dissertation, which was amazing. I had multiple kind of jobs while I was there, so I was able to learn a lot. I started in procurement, buying drugs for their mail order pharmacy, moved into finance, did an analytics position, helped start the specialty pharmacy. And then finally, I did what was called value-based contracting. So it's trying to move from volume to value in the way that we buy drugs, and making pharmaceutical manufacturers responsible for the outcomes and whether they achieve the outcomes that they're supposed to when members take those drugs, and making those drugs affordable to patients and also, accessible so that the patient gets the right drug at the right time. So I did that for the last 2 years at Humana, and then I moved on to OptumRx, which is owned by United Health Group. If you have United Healthcare, then OptumRx is your pharmacy benefit manager. And what I do is basically the same thing now that I did at Humana, but on a bigger scale. I do value-based contracting, so I work really closely with pharma. And I also, in this position, I'm very fortunate. I can also have input into policy. United Health Group being such a big player in the healthcare space, they work closely with people in Washington. So I've had the opportunity to interact with HHS and CMS in terms of policy around healthcare. Yeah, I mean, it's hard when you're busy and you have kids to get, to give back to the community. And so I'm always looking for ways that are easy to fit into your schedule, but still give back. So Fed with Faith is a great organization. On Sundays, you can sign up for time slots, and you go, and basically they put you to work. You might be making peanut butter sandwiches and packing them in bags. You could be, scooping meals that they're going to go out and deliver to the homeless that night. We go and do it as a family whenever we can. And it's really a great way to give back, but it's a good bonding experience with the people that you go with. I still feel very connected to U of L, just being an alumni. I mean, I follow on LinkedIn when U of L posts, I comment. Yesterday on Facebook, U of L Brandeis School of Law was having a panel discussion about Breonna Taylor, and I stopped and watched. I thought it was so engaging, and I think that U of L is making great strides to really embed itself in the community, and I think that's so important. So my current job is very broad. It's not defined, and a straight path and this is what I'm going to do today. There's a lot of room for innovation. So that makes me excited because you really have an opportunity to color outside the lines and think outside the box and just get wild in the concepts that you're coming up with. So every day is different. I'm having conversations with all kinds of different manufacturers and just coming up with different ideas. And, out of 10 conversations, maybe one's going to work, but still that one, might be the game changer, the thing that changes the industry and makes a shift in healthcare for people. And I'm really passionate about, people getting their medications and having access to them and making them affordable. And so I hope that something that I'm doing is in some way contributing to that and contributing to the change that hopefully we see by the time our kids are buying insurance for themselves. I think the best advice that young people, and I give this to people all the time when I meet them and when I'm mentoring or anything, it's network. Like it's never too early to network, even in your undergrad. When you meet people, you need to have a LinkedIn page and you need to connect with all those people that you meet because you never know. It's such a small world and you're going to come in contact with all these people again and just network with them and find out about them and learn something personal about them and just make a connection.